So I'm going to ask, if we were, both of you have your preferred plans, how then do we finance these plans? If it's a public, if it's a federalized health care program, how will we fit that into the federal budget? If it is a private insurance health plan, what do we do about skyrocketing costs and uninsured?
Me, right?
And yes, you go first.
Okay. Basically, that's a huge question. Since I'm more for the private industry, I'll discuss how we keep costs down. Now, affordability is a major concern, and it's a major concern of myself, being a chronic asthmatic and a brother who's been a diabetic since the age of 2. We understand how much health care costs, but there's ways in which we can bring that down. Now, John McCain, if you just take a basic economics course, you realize that if you increase production and stuff, you'll see, and you decrease demand, you see, a decrease in pricing. Now, what John McCain wants to do is make it so you can go across the state lines. Well, Obama likes to say that the average, price of health insurance is $12,000 or so a year. That's because you really don't have many choices. Now, if you can go to every 50 states and pick your own health insurance, they're going to have to start, fighting with each other, and nothing we like more than watching corporate people fight. Because what that does to every single one of you is that decreases the price that you're going to pay for health insurance. Now, John McCain, like you said, the problem is where are we going to come up with this money? This country right now is going through a lot of wasteful spending. Part of that is because of the Republican Party. Part of that is because of the Democratic Party. I believe that's something we can all agree upon, is that when our people go to Washington, sometimes they don't really do what we'd like them to do. So we have to get wasteful spending under control. Now, the problem is, too, they like to say that, affordable health care, but like I said earlier, it's important that we have quality health care as well, not just affordable.
Dan, 90 seconds.
Well, Senator Obama, by using universal health care, which the government helps subsidize the cost, he plans on saving $200 to $300 billion because you don't have private insurance jacking up the skyrocketing cost of health insurance. So by having one, central federal government help foot the bill, you're then decreasing the premiums and all these fees that you normally would have to pay. Just touching upon my point about state lines. Senator Obama is strongly against this notion that you can get health insurance in any state in the country. What's going to happen if we do this plan is that health insurance companies will find some state in the country that doesn't have cancer screening, doesn't have preconditions, doesn't have and it leaves people out. So you're going to have health insurance companies providing the most basic things that, oh, sorry, you're sick today, well, we don't cover this, oh, we got a foot injury, well, we only do arms. Now, that's the kind of thing you're going to get so far.
That's the kind of stuff you get in universal health care. Just go ahead, sorry. Can I just have like 15 seconds? I know that's not on that. All right.
Dan, you got 45 seconds left.
Can I use this 45?
Briefly in this debate, my opponent mentioned about how Freddie Mae and Fannie Mac were a result of government somehow regulation or whatever. It's interesting to note that Freddie Mae and Freddie Mac actually failed because there was deregulation, which Senator McCain actually was a big proponent of before he actually was in favor of regulation. So, they accuse Kerry being a flip-flopper, and I see really why McCain is a flip-flopper in this debate. So I really am having trouble on his issues here.
Your time is up. Alex, you have 15
Thank you very much. Socialist health care policies, as I've already shown you, do not guarantee that everyone gets coverage. You need to just Senator Obama's. Actually, if you look at the actual numbers, under McCain policy, 2 million more people will be covered than under Senator Obama's policy. And that's coming from a third party, so take what you wish with the numbers.
Thank you. Your time's up.
Thank you for that.